Hello, my name is Josh Anderson, and this is my assessment for a patient for their head and neck. To begin, I would wash my hands and introduce myself to the patient. Hello, my name is Josh. I'm going to be your nurse today. I would verify the patient's first and last name and birthday. I would begin by inspecting the patient's face, making sure we get eye level with the patient. I will be looking at their face, making sure that we have symmetry in their face. So making sure that neither side of the face is droopy, as this could be indication of a stroke. I would also be looking at the patient's eyes and looking at their sclera to make sure it doesn't have any abnormal coloring. Looking at the patient's ears, noting if there's any redness around the ears. I'm going to take and ask the patient if I can just feel on their head. I'm going to be feeling for any abnormal protrusions. Feeling none, I'm going to assess the patient's eyes. Again, just checking, making sure that the sclera of the eyes are white, not red or yellow. I'm going to assess the patient's pupillary response. I'm going to ask the patient to look at the far wall there. Using my pen light, I'm going to briefly shine a light over each of the patient's eyes, making sure that the pupils are both equal and reactive. I would then take and feel the patient's lymph nodes. I'm going to use the pads of my fingers using circular motions to feel the lymph nodes down the neck, up in front of the ears, in the subclavicle, and in the cervical area of the neck. I'm going to assess the patient's motor function in their neck by having them take and move their head up and down. Assess if they can move their head side to side. And then have them put one ear to each shoulder, assessing all the motor movement of their neck. I would assess their ability to shrug their shoulders. I would have them place my hands on their shoulders, instruct them to shrug their shoulders, pulling their shoulders up to their ear, and then take and put my one hand on the side of the face, ask them to pull their chin towards their shoulder, and then again on the other side. This would be how I would do a assessment for a patient of their head and neck.